Hi, I'm Dr. Hagmeyer. I'm the clinic director here at drhagmeyer.com, where we help people from all over the world find answers and solutions to problems that they've suffered for years with. In today's short video, I'm going to explain to you one of the most common and most useful tests that I use in practice for people that struggle with chronic health problems. And again, while I don't know the exact reason that you or loved one is interested in doing the organic acid test, I do know that if you're watching today's video, then you're searching for answers. You're struggling with some sort of chronic health problem that you just want to find the answer to. And I can tell you that the best way to really start solving any kind of chronic health problem and finding those answers starts with the right kinds of testing. Testing is a map, and like anything else, you can't fix something if you don't know what's causing it. The organic acid test, commonly known as the OAT test for short, is a test that really provides just a wealth of information into many areas of the body's biology. And what we find is that many times these are the very issues that are rooted in causing chronic health problems. How many times have you been to a doctor for you only to hear that everything is normal, or you're the patient who's had every imaginable test that's been done under the sun, and yet your doctor still hasn't figured out really what's wrong with you or really how to best correct your problem? These are two of the most common phrases that I hear in my office. Organic acids are really metabolic intermediates, and essentially what they are is they're the breakdown products that are produced in a variety of different biological pathways of the body. Here's why these metabolic intermediates are so important to understand. Understanding where there's a metabolic block occurring helps us to tailor a treatment plan to the individual. Instead of guessing where to support the body's biology, we now can look at these metabolic intermediates and support a patient and meet a patient where their body needs are. These biological pathways are just so important for us to understand when we're working with a patient with a chronic health issue. Let's say we have a patient who has depression, or has brain fog, or has fatigue, or has chronic pain, or has a thyroid problem, or even has an autoimmune disease for that matter. There's no single cause to any of these diseases, but we do know that of all these diseases that I just mentioned, they're all rooted in a variety of different biological areas. They might be areas that are related to energy production. They might be areas that are related to compromised detoxification. They might be problems in the breakdown of certain neurotransmitters. There may be problems related to an overgrowth of bacteria, or yeast overgrowth, or bacterial dysbiosis. There may be a methylation issue. But any of these blocks are basically blocking these biological pathways. And these biological pathways could be blocked due either to a nutritional deficiency, an inherited enzyme deficit, toxic buildup, or even drug effects, right? Maybe you're taking so many different kinds of medications. This, again, can be revealed through this organic acid test. So this OAT test provides an accurate metabolic snapshot of really what's going on inside your body. If you look here at this illustration, you're going to notice that there's several different categories or areas of your health this test evaluates. Eventually, when we sit down to review this test, there's really over 74 different urinary metabolite markers that can be very useful for discovering underlying causes of chronic illness. Let me give you a few scenarios on who I might run this test on, because, again, it looks at a variety of different things. I think it'll help you understand. Let's say we have a patient with depression, right? Maybe we want to look at what we call the metabolites of neurotransmitters. These are going to be things like serotonin and dopamine, adrenaline and noradrenaline. Collectively, these are known as your catecholamines. These are part of your fight or flight response. Now, I use this test with children and adults with neuroinflammatory conditions. This might be a problem such as ADHD or autism. Maybe it's a child with sensory processing issues. Maybe it's behavior and learning problems. Maybe it's anxiety. Maybe it's sleeping issues. Maybe it's mood and mental health disorders. So that's one reason. This test also evaluates a variety of bacterial metabolites that come from yeast, bacteria, and Clostridia. This section could be potentially shed light on problems that are ranging from gut problems like bloating. Maybe it's constipation or diarrhea. Maybe it's skin problems. Maybe it's things like rosacea or acne or dermatitis. There are markers that look at mitochondrial function and oxidative stress. Mitochondria are the powerhouses within the cells of our body, and they're responsible for making cellular energy, or something known as ATP. And this affects the aging of cells and how well these cells are able to perform and carry out their functions. Oxidative stress is one of the driving factors that's behind inflammation. It's also one of the driving factors that's behind autoimmune diseases. This test also measures glutathione levels. Why is glutathione important? Well, glutathione is the master antioxidant that really quells the damaging effects and the forces of free radicals. This may help explain some of the problems related to things like autoimmunity or chronic inflammation or brain inflammation. It might help shed some light on why you're experiencing chronic migraines and headaches, maybe why you're having depression, maybe why you're experiencing anxiety and panic attacks, mood and mental health disorders. Another section that I find incredibly helpful is the section that looks at the markers related to detoxification. Here where you can see just how much stress the liver's under and if a detoxification program might be helpful with our patients. Again, this might be helpful in patients with chronic fatigue syndrome. Again, brain fog, poor thyroid function. Maybe you're not converting T4 into T3. We know that the liver plays a very vital role in those functions. And then again, really any kind of GI problem that stems or is related to the liver, right? We know that the liver and the gallbladder is a very important piece and component to people who struggle with IBS and IBD. Another section that helps us understand, how a patient is functioning is the carbohydrate and fat metabolism. Let's say you're a person who's struggling with losing weight, or you have blood sugar issues, you have blood sugar handling problems where your blood sugar is just going up and down and can't get stabilized. Maybe you're that athlete who's wanting to optimize their performance. Maybe you perform or you compete at a high level. Again, this may be an issue for people that may have adopted, let's say, a ketogenic diet. We have more people now doing a ketogenic diet than ever before. But yet we have also, as more people begin to do this, they're feeling tired, they're feeling run down. Well, this may indicate that an individual who is experiencing those symptoms is lacking certain key nutrients like carnitine, for example, or B6, which are both needed in order to take fats and drive them into the cell to make energy. Carnitine serves as a fat shuttle, shuttling fat into the cells. So again, those are just some of the things that an OAT test can provide information on. There are so many other areas that this test can shed light on that a short video like this just doesn't do it justice. From a patient's perspective, the other thing I like about the OAT test is that it's super easy test to do. You can do this at home. You don't need to schedule an appointment in a doctor's office. You don't need to wait in a doctor's office. You don't need to call in sick to school. You don't need to take the day off from work or take the morning off from work. You don't have to drive anywhere. You can do it from home. Number two is that this test is great for kids, and not only young kids, but just kids of all ages, including infants. And that's because this test only requires a urine sample. So kids don't like needles, right? And so again, there's no needles involved in this. For really young kids, we can even collect the urine from a diaper. So some really, really great aspects from a patient's perspective. Another thing that really makes this ideal for patients are unfortunately those patients who are prisoners at home, right? These are people that don't get out. Might be people that are disabled. And perhaps you're watching this video today and for one reason or another, you just can't get out of your house. And just getting out of your house poses all kinds of challenges, right? And so that's another reason that this test can be incredibly helpful to those individuals. If you can relate to anything that I talked about in today's video explanation, I recommend the OAT test and consultation with me. Overall, like I said, this is just a great, great foundational test that should be considered for really anyone who's struggling with a chronic health problem. All right, hope you enjoyed today's video. I'm Dr. Hagmeyer. Take care.